If you enjoyed this video, be sure to hit that sub button for more amazing content. Now, let's jump straight into the video. What's good, YouTube? It's your girl Bofino1 bringing you guys yet another YouTube video. And today I just wanted to get on here and make a quick little video pretty much talking about what's going on with this whole monkeypox situation. So, for those you don't know, the monkeypox situation is pretty much like a smallpox, but like supposedly a little bit, it's not as severe, but because it's so new in a sense, when it hits people are having really bad reactions to it. So pretty much I saw this article on Twitter and just been seeing it posted in general, is that is the Biden administration is declaring monkeypox a public health emergency as the U.S. outbreaks has grown into the largest in the world, the nation's top health officials said Thursday. So they're saying the U.S. has confirmed more than 6,600 cases of monkeypox in 48 states, Washington, D.C., and Puerto Rico as of Thursday, according to the Centers for Disease Control Prevention. The real numbers of infection is likely higher than the official data because patients can only get tested after they develop a rash, which can take a week or more after the initial exposure to the virus. And I've been seeing stuff online, like news people reporting on it, pretty much stating that, it can be transferred, if someone has like a cut on their hand and you guys make contact and, and they were saying that it really wasn't that big of a deal. It's kind of like what they said with COVID. I feel like oh, it's just a few people. It's not going to spread. And lo and behold, look what's going on. It seems like it's starting. We're going down this. We're going down this same path of something that starts off small and it's like no one cares about it, and it's weird, So the article also says monkeypox is primarily spreading through skin-to-skin contact during sex at the moment. Gay and bisexual men are at the highest risk of infection right now, public health officials say. About 98% of patients who provided demographic information to clinics identified as men who have sex with men, according to the CDC. But anyone can catch the virus through close physical contact with someone who's infected or contaminated materials. So, and this is kind of what I was saying, first they were like, oh, it's no big deal, don't worry about it. Now it's like, okay, it's becoming a state of emergency. And it's like with something like this being in close contact, okay, yeah, you could, how with COVID, they're saying a lot of time it comes through spreading of people coughing, sneezing, so they tell you to wear a mask, right? Well, something like this being in close contact, you're still around people. So even if you have your mask, you could still catch something like this. You could bump into somebody that may have this, it you know what I'm saying? You could touch the same thing they touch. You could shake somebody's hand on an interview that has it and they don't even know because they're saying it takes a week. It's almost like COVID. It doesn't, when you catch COVID, at least I haven't caught it, but I mean, people that I know and what they talk about, it takes a little bit of time before a lot of time you even start to get the symptoms. So it's what are we going to do this time? Are we going to have another virus outbreak? Are we going to try to shut things down? And is there a vaccine? Maybe there is. It just seems like we keep going in this same cycle. And it's I don't know. And so they're saying that there is a vaccine, and the federal government has delivered more than 600,000 doses of the monkeypox vaccine called Junos to state and city health departments since May. So they're saying, I guess, that they have pushed them out. Maybe that's why the numbers are not as high. But then at the same time, I mean, think about me. I haven't really heard much about a vaccine. I've heard about monkeypox, but I haven't really heard much about this vaccine. So I also think there's a sense of people just don't know about it. And people are not getting tested for it because they don't know the symptoms. You know what I'm saying? So it's almost like we're kind of going back into the same thing that happened with COVID. If we don't get this under control, it's going to be another outbreak. You're going to have COVID and you're going to have monkeypox, which is going to be bad. You're going to have two things. And a lot of people, like I said, still haven't even gotten the first shot for COVID. But let me know your guys' thoughts about this down below in the comment section. If you enjoyed the video, be sure to drop a like, comment, share, and subscribe. Hope you guys have a good rest of your day, and I'll chat with you later. Peace, Fan Army.